Hello everyone, I'm Roshisun from University of Adelaide. Today I'd like to present our research, Fighting Security and Privacy of Global COVID-19 Contact Tracing Applications. The motivation of our research is that while the global deployment of contact tracing apps aims to protect the health of citizens, these apps also have raised security and privacy concerns. At first, we look at into 10 solutions from 7 countries worldwide. In centralized solutions, there is a central server which collects the contact records from diagnosed users and uses the information to evaluate users' health status and send out alarms to at-risk users. While in decentralized solution, users will download the diagnosed tokens from the backend server and match with local records to know if they are at risk or not. We evaluated user privacy exposure with 5 levels. In level 1, 2, and 3, there is no personal identifiable information, the PII, shared with server or users, which means the user's privacy is protected in some contexts. However, in other solutions such as COVID-Safe, Health Code, Hemaging, Trace Together, and the Disease-19 website, users' PII will be shared to server or even published to public. We assessed the security performance of 34 worldwide Android contact tracing applications. We conducted code analysis using MobSF, data flow analysis with FlowJoint, and malware detection using VirusTotal to evaluate manifest weaknesses, vulnerabilities, privacy leaks, and malware. The results show that over 90% of apps use at least one insecure cryptography algorithms. Another frequent weakness is clear text storage. We found that about 3/4 of apps contain at least one checker, which may leak users' privacy. The data flow analysis shows that sensitive information may be leaked from sources to sinks, such as location information to output stream. Some apps even transmit location information through messages, which is extremely dangerous, as other apps could also access the message sending box. And we discovered one application, the Stop COVID-19 KG, contains malware. We have disclosed our findings to related stakeholders and received acknowledgments from numerous vendors. Here is the results of regression testing. Some apps do improve their security performance in update versions. Then we further assessed the privacy risk of the 10 solutions against the 4 types of attacks. We found that the centralized system could be vulnerable to linkage attacks by server, as sensitive information could be stored in the central servers. And the system that publish user PII or based on information exchange between users could be vulnerable to linkage attack by users. A malware user may raise false positive claims to the system if there is no authorization process implemented. And a system based on Bluetooth or other information broadcasting are vulnerable to relay attacks, in which a malicious user can replay valid identifiers to redirect all the traffic from one place to another in order to virtually forge the footprint of the contact, causing the target area to be falsely locked down. Based on our analysis results, here represents our privacy by design, the venue trace, which broadcasts the venue ID in public places. Users will receive and record the venue ID during their visiting, and the diagnosed user could upload venue ID records to backend server. Other users will download the diagnosed records from the server and match with local records to know if they are at risk or not. Thus, there is no information exchanged between users, and there is no PII sent to the backend server. means that the user's privacy will be well protected in our system. And in the future, we're planning to examine BLE and the network traffic and any vulnerabilities associated with iOS counterparts. Thank you for your time. If you're interested in our research, please feel free to email us. Thank you.